The Sine Institute of Policy and Politics is American University's incubator for policy innovation. We convene leaders in the academic, public, private, nonprofit, and journalism sectors to engage and promote common ground and nonpartisan solutions. In an evolving world, we seize the opportunity to work on the nation's most pressing challenges through collaboration by experts and top scholars in their field with students in research and scholarship. As part of that goal, the Sine Institute leverages American University's location in our nation's capital, the nexus of government and a growing international business center. We connect diverse perspectives from around the country and around the world with our world-class academics and research, experienced practitioners, and the most politically active student body in the U.S. We stand apart through our focus on the role of business and the nonprofit community in public policy, the rise of the importance of economic regions in the United States, and international policy issues. Our focus is to make an immediate impact at the intersection of policy and politics that leads to real and lasting change. Thank you for joining us as we convene, communicate, and collaborate. Welcome to Reimagining America, the next steps in the COVID response, working towards a resilient food supply chain, with moderator Katherine Miller, Sine Fellow 2020.
Hi, everybody. Welcome. Thanks for joining us this afternoon. I want to just welcome you to this, and is the first of 6 in this series of Reimagining America, put on by the Sine Institute of Policy and Politics at American University. Today, we're going to talk about food policy and politics and what we saw in the COVID, the early days of COVID, what we saw in the response, and what we're going to look for the future. I want to just first say a couple of special thank yous. I want to thank American University President Sylvia Burwell, Dean Vicki Wilkins, who's the Dean of the School of Public Affairs at American, the Sine Institute's Executive Director, Amy Dacey, Lanesa Clarkson, who is one of the folks that helped set this up, and Charles Leggett, who is on the public affairs team at AU and really helps make these happen. We're here today, and they're going to turn their videos on now with 2 of the most respected voices in the food world. I'm so thrilled. I didn't actually realize this until just a couple minutes ago, that this is probably the first time these 2 have been on a panel together, and I wish it could be in person, but we'll go with video. But I want to welcome activist, mentor, educator, the director at the Food Lab in Detroit, Davita Davidson, who has always been an amazing collaborator and educator and encourager of all things positive in the food system, and all things tough love in the food system too. And with her and with me today is Helena Miller Ivic. She is a James Beard award-winning journalist. She also has a Polk Award, both in for the series you did on climate change, and then her writings on the food system. She is the senior food policy journalist at Politico, and also is one of the editors and co-authors of a morning newsletter, the Morning Agricultural Report. I think I got that wrong, but we'll get it right throughout this. These 2 are just amazing voices and followers and champions of everything that relates to the food system. And so what I want to just start with, I want to just check in with both of you and sort of how this is going to move for the audience. We're going to check in, we're going to chat, we're going to talk about some important things. There is a chat function if you have or question function. So if you have a question and you want to raise your hand or put it into the Q&A, please do. We'll try and get to those either through the course of conversation or towards the end. But this is really an open conversation, kind of looking at that pandemic, what has happened and what's become visible in the food system during the pandemic. And, we were sort of emailing back and forth about this, but one of the things that I find for both of you, I'd love to just check in with you about how you were doing, but this was pretty jarring in terms of the food system. I mean, some of the most visible images of COVID related to food and food workers, whether it was in the early days of empty grocery shelves and shortages, whether it was the farmers throwing out milk and vegetables, to just these past few weeks, the protests and the strikes that have been really led by food workers for better wages in this country. It's been a really remarkable, very visible time. Let me just start with you, Helena, because you're also a new mom and all of this. So you've been covering this both personally and professionally, I think, in some ways. But what's your image? What's your sort of defining moment of COVID?
Yeah, thank you so much for having me. I'm delighted to be here. I was just telling Katherine before we started that when I came back from maternity leave in April, I cover food and ag policy, and my editors and all the top editors were like, "Oh, good, you're back. Milk is being dumped, produce is being plowed under. The entire food system has been, disrupted. And I don't like to use the term unprecedented, but in a truly unprecedented way, where we completely switched off food service, which is like a totally separate system almost. And millions of people are unemployed. Food insecurity is spiking. Food and farm workers are getting sick. We don't know what we're gonna, it was just complete disruption and chaos. And I think anyone who, has been in the food system, who has followed these issues, we knew about these deep inequities and frankly racist structures. We knew about the problems, we knew about the weaknesses, but to see it unfold in such a dramatic and such a visible way was still incredibly stressful, and frankly, I think emotional for everyone who had to really, really look at it every day, and obviously way more stressful for those actually experiencing the fallout every single day, whether it was a lost job or an outbreak in the workplace or complete shutdown of your workplace. It was incredibly stressful. I started using the term rage stroke as a way to describe my mood, because
Yes.
it was chaos and just sort of government response failure after government response failure. So yeah, that is how I would describe most of it. It really depended on, what issue I was diving into. There were so many things to keep up with in terms of nutrition response and work, the lack of worker safety, regulation and enforcement. There were so many things. And I think right now we're sort of pivoting to this moment of, we were in crisis response mode for so long. And now it's sort of the questions of well, what are we going to do differently? And what I'm really watching for is, where are we actually going to make sort of the big changes that seemed like they needed to happen while we were in it? And where are we just going to kind of do incremental things? And I think that's a big question right now on a lot of these issues.
Oh, no, I think that's sort of the biggest question, what we're going to deliver on, what we promised and what we're going to deliver on moving forward. Yeah. But Davida, so much of this was on the sort of, once again, on the backs of the workers. So much of this, how are you doing? And Helena, I really appreciate that you saying it was emotional, because I just feel like the last 4 months have been truly sort of a roller coaster of emotions. But Davida, how are you doing? And what was sort of your most visible or the moment for you in the early days of this crisis?
Yeah, thank you so much, Katherine, for that question. And Helena, it's so great to be in conversation with you. I'm a big fan of your writing. I had to think about this for a while. And I hope I can get through this, Katherine, without getting too emotional. But I'm going to say this, is that I am so blessed that I am in a position where I'm starting to see some light at the end of a very, very dark tunnel. And I'll say this, 2 weeks ago, ladies, we commemorated a holiday that was called Memorial Day, right? It's a day in which we take the time to stop, to remember, and to memorialize those and to thank those who gave their bodies, who made the ultimate sacrifice of their life, their bodies, when the government called. Those individuals answered the call, and they went off to war, and they fought on the behalf of this country, and we honored them on a day that was called Memorial Day. And the reason why I just wanted to lift up Memorial Day is because throughout this whole time that we have been going through this pandemic, I think the time, Katherine, to answer your question, that stands out the most to me is the time in which we had a change of leadership. It had to be when we elected the Biden-Harris administration. And the reason why I say that, in the connective tissue between honoring those that answered the call on Memorial Day 2 weeks ago and the change of leadership, is that I finally, Katherine and Helena, got the opportunity to answer the call of my government. I did not serve in the armed forces. My daddy did, and dear friends of mine did, but I never served. And so when the Biden-Harris administration asked us to do 3 things, I finally had the opportunity to serve my country in a way in which my government called and I answered. The Biden-Harris administration asked us to wear a mask. I had been wearing a mask, so it was no big thing for me to continue wearing my mask. They asked us to social distance. I don't like to use the word social distance, but I'm going to use the word physical distance. I don't use social distance because I think that we found some really creative ways to still be social, even in the midst of a pandemic. But they asked us to be responsible and to be physically distancing ourselves, not just to protect ourselves, but to protect those that are most vulnerable. And then the last thing they asked us to do, that when it was your turn, to get the vaccine. Katherine, Helena, I had to tell you, I'm fully vaccinated. I didn't expect to get this emotional, but when I got my second vaccine, I broke down in tears.
Yeah.
Because I answered the call.
Yeah.
And here's the point. This is the point that I want to really make, in which I try not to get too emotional about this, is because when I say I see a light at the end of the tunnel, when I'm gonna connect this back to the amazing community, Katherine, that you and I are so blessed to be a part of, which is the restaurant and chef community, is that the reason why I say that there's a light at the end of the tunnel is because, by God, America is going to be and show the world what we are capable of. And that is, not only are we going to vaccinate our citizens, but we are now giving out vaccines to the most vulnerable, the poorest countries all over the world. And we want to make sure that those individuals who live in those poor countries, that they're able to vaccinate their citizens as well. And the only reason why I mention that in closing is that even in its darkest hours, Katherine and Helena, the chef and the restaurant community, as they were fighting like hell to save our industry, they showed out and showed the most hospitable kind of moments in the world when they turned their kitchens into community kitchens, and they were vulnerable and they still fed the most vulnerable in their community. No. That's what just fills my spirit.
No, it was amazing to watch that. And I thought where you were going with Memorial Day, which was what made me think about it, was also our food workers fulfilled the call to service.
Oh, yes.
Throughout all of this, our farm workers went to work, our meat processing plant folks stayed in, our restaurant workers stayed, and they got sick and they died.
Yes, they did.
And in service of a food system that is fairly broken and doesn't actually lift them up and support them in the ways that it should, right? So I think about what both of you said, right? This intersection of it, like the visibility, for the first time, every American saw what all of us see every day, right? Which is that this is a system based on systemic racism. It's a system that doesn't prioritize its workers. It's a system that prioritizes potentially the wrong things related to the delivery, but that's how it was built, right? It was built to function exactly the way it did, and then it broke. And everybody, Helena, you and all the journalists out there that were reporting it made it so visible, those lines, the food dumping, the breakdown in leadership. And then Davida, to your point, these workers showed up every single day, you know, and did the things that no one else wanted to do, right? Whether I was, a slight aside, I was in a restaurant in California this weekend, and the check at the bottom had the tipping scale, and that also had the worker here is risking their lives and doing things to make your experience safer. At the bottom of the check, I was like, nice call out.
Yeah, so absolutely. Yeah. No, what I was just going to say, Katherine, and I'm sure Helena's going to jump in on this too, because you're right. Some of the best reporting coming out of this pandemic were those individuals that were on the ground, visibly showing us what it looks like, how fragile our food system is, all the way from farmers to processing, distribution, to who receives it, where they receive it, et cetera. And I think that one of the things that stands out to me amongst all of this is that for those individuals who care about frontline workers, who in many cases were the most food insecure, if you care about food insecurity, you need to understand that food insecurity is not a matter of access, but it's a matter of power. Not a lack of food, it's a lack of power that they don't have. And so just to tie that all together with a tweet that I put on Twitter that went viral, really, is that I had put 3 or 4 signs that I had saw all over the internet. And they were just white paper signs of fast food restaurants that either were not opening, could not operate to its full capacity, or workers who just refused to go back to work, not because of the narrative around they being too lazy and they're on unemployment, but it's because they were sick and tired of being undervalued, not appreciated, and working for, in my opinion, low and exploitative wages. So they didn't show up. And I just posted on my Twitter that we're seeing the largest movement amongst food workers, and we're seeing it demonstratively by white paper signs at fast food restaurants.
No, 100%. And I want to, Helena, Davida raised a good point about sort of citizen action, and you raised the point and your thing about the change in leadership, right? And both of you sort of touched on that. Helena, have you seen over the last couple of months as we transition into the Biden-Harris administration and Tom Vilsack back at USDA, what are you seeing in terms of a change in tenor or tone? Can you describe a little bit about pre-November tone response related to food and what we're seeing now?
Yeah, I mean, it is just objectively, it's night and day, especially in terms of how the administrations talk about frontline workers. So whether or not the full extent of policy changes have like demonstrably improved lives at every level, like I think that's very TBD. But for example, last summer when we were doing a lot of reporting on farm worker outbreaks and risks, we couldn't even get like the federal government to get, like anyone from the federal government to even like get on the phone and talk about how are we going to prevent outbreaks among farm workers? I mean, because even if you don't approach this from the perspective of these are human beings who matter, even if you're not approaching it from that perspective, they are crucial to the national and food security of the country, because the whole system breaks down without farm worker labor. I mean, it just does. That's just a fact. And you couldn't even get federal officials to talk about what they were doing. I mean, there just wasn't like a coordinated response. I remember like being absolutely floored by realizing there weren't even like coordination calls happening between states in any organized way, because a lot of farm worker communities move with crops and with seasons. So you would think during a pandemic you would have some sort of like concept of how could you mitigate some risk and sort of prepare and plan and have PPE in the right places and just sort of like have some things that seem sort of common sense during an emergency. And there was just none of that to be found. I mean, certainly some states and localities like stepped up and did a lot. There's some companies, frankly, that stepped up and did a lot, but there were some that didn't. And watching that lack of response, and then now to have an administration who, where you see officials very much talking about, farm worker protections and not repeating some of these mistakes, and you hear more talk about raising the minimum wage, and just sort of this whole sort of pivot has just been, I think, night and day in terms of how you hear frontline workers being talked about. And I think continuing some of the unemployment boosted benefits, continuing increased SNAP benefits, continuing and extending things like pandemic EBT, which helps a lot of families that are undocumented if their children are U.S. citizens and in school. I mean, there's so many pieces of this that have changed markedly. But I think that the biggest noticeable one is the tone and the actual like acknowledgement of there needing to be a policy coordination and a policy focus on the most vulnerable workers who are just frankly the absolute key to the entire food system. And I think there is a lot more public acknowledgement of that fact. I think a lot more people understand that now.
Yeah, I hope so. And even, I mean, even what we're seeing just days ago, right, with the hack into the meat processing, like, I mean, every time we turn around, there's a news story about how vulnerable our food system is, and with workers sort of at the centerpiece of that. And Davida, you mentioned that. I loved that tweet that you sent out with the signs, because I do think what we're seeing is almost a worker uprising of a different type, right? They're not, and I don't, you know, not to be too partisan about it, but I mean, all of the states that are discontinuing their unemployment benefits are Republican states, right? They're not letting it go through to September. And so even if you don't care about these people as humans, the idea like this is all impacting everybody's ability to access food now, the grocery stores, workers. So, I mean, Davida, you want to talk a little bit about what you're seeing? I mean, I think you've just been so passionate and such a voice uplifting all of the worker movements. I mean, I'm super excited about what I see there.
Yeah.
And there's a shout out to you, and I'll follow up with a question from the chat, who says that Detroit Food Lab is doing amazing work. So congratulations. And they also want to know a little bit more about the worker-led movements that you're seeing happen.
Yeah. So I wanted to,
sorry, David, I just also, Helena, like I want to encourage you at some point to, we'll come back to this, the worker piece in relation to the policy side and some of the stuff that we're seeing at the federal level. So just FYI. So go ahead, David. I'm sorry, I talked over you.
Yeah, no worries at all. I just wanted to piggyback on a point Helena made, and also point folks to the chat box where I shared just a couple of links, and that is when we talk about the response, and I'm going to tie this in, is that one of the things that I can truly appreciate, particularly around the government's responsibility of taking care of its most vulnerable population, particularly those individuals in the food system, is what I'm seeing and what I'm reading about. Some of the best reporting that I've been reading about is some of these community-led efforts. I love approaches that are being done, and Katherine, you know me very well. I love approaches that are being done from the bottom up as opposed to being from the top down. And two of the ones that I really, really love is the Washington Post, and again, I put it in the chat. And again, working with community healthcare providers and community pharmacies, like they are vaccinating the farm workers in California, and just a remarkable job that people are doing on the ground in their community. And I think as it relates to the African-American community, a community obviously that I'm a part of, where there is, and listen, and I completely understand it, it is rightfully so, there is some vaccine hesitancy in our community. But one of the things that I love is this approach, again, about getting community involved, whether that's the churches and our trusted institution of barbershops and beauty shops, right? And that community-led approach is something that I love that I'm seeing. And I love that I'm seeing, again, this bottom-up approach when it comes to worker-led movements as well. I think one of the ones that is most prevalent, if folks have not been paying attention, and they have been on the ground for years, and this is their moment, has to be the Fight for 15. And so the Restaurant Opportunity Center and High Rose Restaurants, they have been engaging in the Fight for 15 for many, many, many years. They have been doing great work. And so I'm definitely seeing that movement. I'm seeing it ignited. I am seeing more and more folks get involved in the Fight for 15. I truly believe that $15 minimum wage is going to happen, and it's going to happen soon. As a matter of fact, it's already happening in some states. It is already taking place, just not on the federal level, but I do believe that we are going to see that. And I think another movement, Katherine and Helena, that I'm really excited about as well, and you're talking about somebody who's sitting in the city of Detroit, someone who sits in a pro-union household. You're talking about somebody who is a daughter of the UAW, and that is the movement for workers to unionize. I think even though it did not pass, and it was, and some people may say unsuccessful, but my father is a native son of Bessemer, Alabama. And the reason why I bring up Bessemer, Alabama is because not too long ago, the fight for unionization at one of the Amazon warehouses took place in Bessemer, Alabama. And lo and behold, who was helping the workers organize in Bessemer, Alabama to try to get a union in that warehouse? It was the chicken food processors from the chicken plant down the street who has successfully organized their chicken plant. So to see food workers who work at these processing plants go hand in hand with warehouse workers to form unions, I mean, that's what I'm seeing on the ground too. And let me tell you, restaurant workers, coffee shops, Tartine Bakery, Katherine, you know this very well, unionizing. And so this fight for unionization so that workers can collectively begin to lift up their voices is a movement that I'm also seeing on the ground.
Yeah, you brought up the local approaches, and I think that there are a lot of lessons to be learned in how we saw a lot of communities come up with their own solutions. Whether it was plugging in restaurants to feed low-income people, or whether it was, caterers completely transforming their operation, whether it was neighbors just setting up, I feel like mutual aid is like really taken off in terms of just neighborhoods and like micro places, having their own response. I think one of the things I'm not seeing really is how we are having a federal policy conversation about how you can support those micro efforts or extremely targeted community-led efforts in a way that makes sense, because all of that was done without really federal support in the first several months of the pandemic. I mean, there was certainly money flowing in CARES Act funding. There was a lot of money put into the system for things like, increasing SNAP benefits and sort of direct emergency response. But one of the things USDA is doing now is trying to figure out like how to get smaller businesses plugged into like emergency food aid. So it's not just like large scale, commodities that are going into that system, but you have like more small businesses, more underserved producers. You're going to have more people of color actually selling into that system. And that's one of the things they're experimenting with. And we'll see how it works, because there's a lot of bureaucracy in that system. So I think those are the kinds of things that probably should be worked on a lot right now in terms of like connecting those dots, because right now we have a lot of money flowing through this system at the federal level, but the degree to which it is like actually supporting those very, very locally driven, locally led response efforts, I think a lot of times there's a break in the chain there.
No. Helena and Katherine, let me just jump in. I want to piggyback on what Helena said, which is so important, and look at the flip side of this. And the reason why I say look at the flip side is that you're talking with someone who identifies as a localist, and someone who also spends a lot of time trying to cultivate and build what I would call a just and fair local food economy. And can I tell you how labor intensive that is? Here in the city of Detroit, one of the things that we hold near and dear, and dare I say that Detroit is the epicenter for urban agriculture. So in the city of Detroit, we have about maybe 18 or 19 farms and gardens. A lot of them are backyard gardens that's taken care of by families, but we do have school gardens, community gardens, and market farms. Last year alone, according to the according to the nonprofit organization that keeps this data, the city of Detroit probably grew about 400,000 to 500,000 tons of fresh fruits and vegetables in Detroit proper. And in order to do that, like the city of Detroit and the organization Keep Growing Detroit had to pass out, maybe 300,000 transplants, 75,000 packets of seeds. It is the only reason why I'm bringing this up. And at any given point in the city of Detroit during harvest time, there are about 30,000 Detroiters that are engaged in harvest season. And the only reason why I bring that up is to show that in order to build a local food economy, one that is what we call food sovereign, that's what Detroiters are working toward. It takes a lot of labor. And the question that I have, and I ask myself, if getting food to people is so labor intensive, particularly those individuals who are most vulnerable, wouldn't it just be easier just to give them money and then let them buy their own food, right? Like it's the tension that I hold in my heart, right? And when we have, and then if we look at it from that perspective, Helena, then we can say we are having that conversation, and that is we should be having the conversation then about those that extended unemployment benefits, or can we start talking about universal basic income, the child tax credit that just came through from the Biden-Harris administration? Like now we can start talking about, well, how can we get money to the most vulnerable folks? And so I'll leave it there.
Yeah, and we've seen a lot of data in this. I think one of the real wonky policy learnings of this, if you take out the human element completely, if you just look at that, we have so much data on how households survived and did not survive week to week during COVID. The Census Bureau is still measuring daily households impact, not just on whether they're able to feed their families, but are they behind on rent? Can they pay their utilities? We are, I think, for the first time in history, watching in real time how households are faring. So we have a lot of data on how these different policies have worked, and there is no question that the last two rounds of stimulus aid dramatically helped to reduce food insecurity. I think it was down 40% from the peak in December. So, policies, they have an impact, and we can measure that, and we can see that. I did a story last month about how dramatic a lot of this has been now that you've seen even more SNAP benefits, more pandemic EBT, more stimulus. And I had a line in the story that was like, Washington is learning, if you give people money, they will feed their families. And that is just literally it. And you can debate whether or not you want to do that, whether or not Washington should do that. You can have that debate, but you can see in the numbers that is what happens. If you give people money, they will feed themselves. And we brought up the urban ag thing. I just have to say, USDA is trying to do more money for urban ag. I think Biden's budget had 9 million, just to put that in perspective for folks who probably don't follow USDA. USDA is over $150 billion department in terms of money. I think it's a lot more now, actually, but as of last year, and 9 million of that is now carved out for urban ag. So it's this little tiny seed in the macro policy space. And I mean, there are definitely a lot of people who think there should be more support for that. But you make a really good point that it's extremely labor intensive. And I think you have to have a conversation about do you pay people to do that work? Is that work that the city or the state or the region feels is crucial and important and worth investing in? Or do you rely on nonprofits? I mean, there's so many questions about kind of how you rebuild and how you build the ideal system. And I think a lot of cities actually are probably better about having that conversation than we are at the federal level.
Yeah, but I think it's where you guys are going, which I find is so interesting, is lots of scientists and data scientists had identified for years about a $5,000 gap between food insecure families' ability to feed themselves over the year, right? That no matter how much aid we gave them, was somewhere between $4,000 and $5,000 a year, right? We now know that if we put that money in people's pockets, they will spend it, they will feed their family. There is the push, and it can seem very sort of erudite or a lead around, local, without the support systems. But the other piece is this policy piece of loosening the levers, right? Freeing up that capital that can go. I mean, expanding that urban agriculture from $9 million to a much greater exponentially, because those communities can then start to build, and they can start to also market in a way that makes scale not just something that belongs in Tyson's, at hand, but scale belongs in the sort of the cities and the state. And but some of that is that freeing up all the challenges to accessing capital. I mean, it was really interesting to watch the development of the work of the PPP during the early days of relief, this new restaurant relief fund, but watching that restaurant relief fund alongside of the small business relief fund that was set up for event venues, because the difference in what they required was with the same agency. The hurdles for those restaurants in the restaurant relief is so much lower than the paperwork that the event venues have to fill out. Like, it's totally fascinating. And that is absolutely a result of lobbying, a result of sort of organizing to simplify and streamline those and get in there and talk to folks. So Helena, you're so right. And I know that Davida, you believe this too. Like, it is literally like a web of things that if you pull one, it goes in the other direction. If you pull it in this, and so you have to think about it as a system in a really different way, because it touches everything. I mean, it literally touches everything we do.
Yeah, you brought up the JBS hack recently or earlier, and so if any of you haven't been following, there was a major hack of JBS, which is the largest meat company in the world. It's a Brazilian company, and they own like 20% of beef processing capacity, and like a really major poultry and pork producers or processor as well. And when they got hacked and went offline, it gave us another example of sort of the vulnerabilities that can come when you have like that incredible scale. Like, it's incredibly efficient. It's very, very efficient. That is why we have among the cheapest meat in the world, and it's efficient in terms of like money and scale and all of that, and that's like not in dispute. But the question then becomes like, are we resilient? Can we withstand shocks? Can we withstand one of these companies going down? And I got to interview Secretary Tom Vilsack a few days after that had happened, and he was like, first of all, good job JBS for having a backup system and having like some cybersecurity measures in place, because it would have been like really catastrophic for them to be down for a really extended period of time. But his second point was like, how do you make it so that meat processing, there are more plants, there's more small scale, there's more medium scale. I mean, we've lost a lot of that, most of that in this consolidation. And how do you strike that balance between like resilient and diverse and diversified, regionally diverse, and how do you strike that between like efficient and affordable? And I think that there is a real tension there. And when you do increase processing capacity and you do decentralize a lot of this stuff, you are also decentralizing economic power and money, frankly, and market share, and it's not uncontroversial, right? It is something that there are fights over here, and there's a reason why it's hard to just start a small meat plant up and to have that processing capacity. But I hear a lot of folks in like the restaurant sort of like foodie side being really interested in building that back, for that reason of being more, being better able to withstand shocks, and also, frankly, to get more specialty items and more, locally sourced and regionally sourced food. And we just have a lot of barriers, a lot of policy barriers to that right now.
So Helena, could you give me and you and Katherine mentioned it, the acronym again for the meat processing plant? You said it was JBS. JBS. Okay, JBS. Yes. I'm gonna try to draw a connective tissue here. So, and you said JBS processes what? Probably about, you said 30%?
It's like, I think it's 20% of the fed cattle. So a really big chunk of all of their plants went down for, I think it was about a day.
Okay, so JBS. I'm gonna give you an acronym for another company, and this company is JAB Holdings. So JAB Holdings owns Krispy Kreme, right? And they announced last week that they had their best year ever. right? In the middle of a pandemic, they had their best year ever, $1.1 billion. And they also announced that they're filing for their IPO. And so while everybody was excited about the fact that Krispy Kreme gave away free donuts after you were vaccinated, folks are not following the money and understanding the finances behind a company like JBF that owns Krispy Kreme. Like Katherine and Helena, not only do they own Krispy Kreme, but they own Panera Bread, they own Pret a Manger, they own Calvin Klein fragrances, they own Pete's Coffee, they own Einstein Brothers Bagels, they own Stumptown Coffee. It is the massive mergers and acquisitions that took place in the food industry during the pandemic was massive. And to my knowledge, the only two individuals that really stepped up and wanted to pass what they called a pandemic anti-monopoly act was Senator Warren and AOC. They wanted to put a moratorium on all mergers and acquisitions for companies that were validated, had a market cap of more than $100 million, to stop it during the pandemic, because what we saw was a major consolidation of more power through M&A acquisitions of food-based businesses during the pandemic.
Yeah, that I had not heard all those examples, but that probably deserves a little bit more scrutiny in terms of like where we ended up. Are we more consolidated? Are we more, our I think just the question is like, is our food system today more resilient than it was before COVID? And I don't know that it is. I mean, I think we have a lot of, like we talked about, locally led efforts that could like stand back up if another similar shock hit, but I don't know that a lot has like really fundamentally changed. And I imagine there has been a lot of consolidation during the pandemic because of the, dire financial straits that folks were in. And, what did the restaurant fund just open last few weeks? And there was a long push for that. And I know that, some restaurants definitely benefited from PPP, but there was so much upheaval that I think it really opens the door to consolidation. And I just have to mention, you brought up, I did not know that Krispy Kreme had its best year ever, but that is the other thing that I see us not talking about at all. And it is the, there was a lot of increased consumption of, processed foods and comfort foods and this whole, you've seen some coverage of that, just how these companies are just, they had a gangbusters year. But what I'm not seeing after COVID, which I think a lot of people expected we'd see more, is like this question of like, are we going to really get serious about diet related disease and how much more vulnerable that made us to COVID to begin with? Yep. Our country generally is very unhealthy, metabolically unhealthy, weight-wise unhealthy. I mean, there's so many diet-related diseases. Even if you leave weight out of it, like we have a lot of diabetes and metabolic conditions that are extremely expensive and incredibly costly in terms of like human capital and our ability to like enjoy our lives and live long, productive lives with our families. And I don't see a big conversation happening really about how or what could maybe be done to, make progress on our diet related disease epidemic. So I know there were a lot of folks in the food industry who are really worried that there'd be this big swing and this big focus on health and nutrition. And I really haven't seen that. So it's kind of an interesting aside.
Yeah. And I think it would be interesting to, look at as Davida raises, the consolidation issues versus, because I do think that our community-based food systems and our individual resiliency was amazing. And the farmer and chef and producer's ability the number of farms who sourced to grocery stores and restaurants who then turned around and started their first ever CSAs, or the restaurants who became feeding centers, or the feeding centers that became restaurants. There was so much, that dreaded word pivot, and so much examples of resilience. But this question of consolidation in our food system is an incredibly important one, because it's at the same time the people who are then, not only do they control the food we eat, but they control the marketing arms by which that then sell us the food that we eat, right? So there's I think there's a huge untold or not told recently story in all of that. And then it's also a question, and we have this in the chat, so I want to kind of bring it over here, which is this question of food workers. part of our history as a country is all of our canneries went away, all of our meat processing went away, all of these things consolidated in some ways to make us a more healthy, have more healthy communities, in some ways to remove things that were unseemly, and in some ways because those jobs were going elsewhere, right? Or there was more value in that food chain. And now we want to rebuild the system, but we have a third of our workers are undocumented who are working in the fields. They're underrepresented. They're being allowed to get sick and die. Like, we're not protecting them. And so one of the questions in the chat was, or in the Q&A, is how can we actually expect to have a better, more equitable, resilient food system if we're not actually focusing on those workers? And that is a huge policy play, and it's a huge activist play. And David, I don't know if you want to go there first, and then we can talk a little bit about what USDA is doing or others are doing.
Yeah, that's such a huge question, and that is, I was going to see if I could try to do an experiment in real time. I don't know if it works or not with this particular package, if it is what I think it is, but we'll see. I was, Katherine, not only did you bring up the fact that so many of the food workers along the food chain period are undocumented workers, but also, as a result of that, or in addition to that, and I think you lifted it up earlier, that the most vulnerable bodies that were deemed essential, those who answered the call, showed up in the fields, were in the kitchen cooking. Their occupations were listed at number 1 and number 2 of those that were affected by COVID deaths, right? That much we do know. And so again, I hearken back to this narrative that is being elevated that workers don't want to return back to work because they're getting enhanced or extended unemployment, not understanding the fact that so many of those workers are, number 1, and I don't say this to be hyperbolic, but those workers are either dead, and I'm gonna sit with that for a minute, or they saw a coworker die, or they were infected by the virus themselves, right? And so to go back into those harmful working conditions, number 1, people are thinking twice about that. Number 2 is, Katherine, not only are so many food workers, particularly those who work in restaurants, not only were they undocumented, but so many of them are women. So many of food workers are women. And so, Katherine, when you don't have childcare at home, if you are a working mom and you don't have childcare at home, are you going to be rushing back to work? Hell, you've already had to play the role of teacher, and you're teaching your children virtually. And now you're going to try to come back to work and you don't even have childcare to take care of your children. So we're not talking about that. And here's the third and final one where I want us to, I don't think that we're doing enough concentration of when we're starting to talk about workers. I was listening to this really interesting podcast with the CEO, and I can't think of his name right now, but he's a CEO, and what he owns is of real estate. But the real estate that he owns in his portfolio are buildings, commercial buildings that are warehouses. And he has seen an explosion in his portfolio of acquiring more warehouse space. And the reason why, and one of the things that he talked about, is that he said the way that we shop today is very warehouse intensive. Think about this. And he gave the example of a pair of earbuds or a pair of headphones. He was like, traditionally, or before, what we would do if we wanted to get a pair of earbuds or headsets, we would go to the store and we would buy them. And he was just kind of like, and you think about, a lot of people don't think about the warehouse capacity that it takes, or the logistics and distribution that it takes to get a crate or a cart of earbuds or headphones, right? You receive them into the warehouse as a cart, as a crate, or as he called it, a pallet, and then you ship them off to maybe Best Buy, or maybe to Sears, or maybe, to an electronics store. Not a warehouse, not a lot of warehouse space that requires. Actually, talking about really big pallets that you're shipping from one place to another, really B2B. Now, everybody's ordering online. He's like, that takes more warehouse space and it takes more people, because now what you have to do is you have to unbox that pallet, and you have to break that pallet down. You have to take out each individual earbud or each individual headphone set, and then you have to pack it in an individual box, and then you have to ship it out to the person who just ordered that online. And Catherine, what we're not talking about is how so many restaurant workers, they aren't going back to their restaurant industry because they found other jobs. I'm not saying better. I'm just saying that they found other jobs in safer environments, a more predictable schedule, doing warehouse work. And I don't think that there's enough work or enough stories being told about the migration of where did those restaurant workers go? Where'd they go?
Yeah, I mean, they went to serve delivery services, right? And shoppers and right. And as you say, I mean, the food business is notorious. Restaurants, they're awful, you know, the sub-minimum wage, the hours, the unpredictability, the rampant sexism, and the same is true of farm workers and food production workers, right? Like the people who produce our food are the most underappreciated, underprotected populations of people out there. The stuff that they put up with in order to do that, and in most cases, get a federal minimum wage or lower wage is really, you know, is really amazing. And I think
and they don't often don't qualify for safety net programs, which I think a lot of people forget. You know, you don't get SNAP.
Nope.
You don't get unemployment insurance. You don't get a lot of things that, you know, we have access to in like really dire situations. And, you know, it felt like at a certain point, a lot of undocumented workers in this country, the safety net was whether or not people ordering were going to tip. I mean, that felt like the safety net for several months, where it was sort of this long drag of people barely hanging on. And, you know, we didn't pass a COVID aid bill from March to December. People forget that. It was March.
No, it was
late
Yep.
March to then December. We did not have another one till December.
That's right. That's right. And Helena, yeah. I just wanted to piggyback on that. There are so many things that you and Katherine brought up, and I know I'm about to get a little controversial, and I'm probably gonna get in trouble for this, but you know, I have to say this because you brought it up. And I love the fact that number one, you brought up the word safety net, which is huge. And number two, I didn't want to let this go, Helena, because I think we just kind of brushed over it. But this is so important to me in the work that I really, the work of Food Lab is really about how do we influence and impact what we call the social determinants of health, particularly from an environmental standpoint. When you live in a community and you don't have access to fresh, healthy food, you're eating out of gas stations or bodegas or party stores or fast food, in terms of how that affects your health, right? So the word that we heard about during the pandemic, it was something that was called comorbidities, or what we call pre-existing condition. And those individuals that had comorbidities, high blood pressure, diabetes, cancer, obesity, how their bodies were already vulnerable, they became even more susceptible to death as related to the virus. So these diet-related diseases that we lift up. And here's the deal. I don't want to discount the fact that we lost, you know, close to what, 500. I know our president keeps the number in a piece of paper in his pocket, but you know, we lost close to 500,000 people. Millions have been affected by the pandemic. But dare I say, more people die of diet-related diseases every year as well. Not to take anything away from the pandemic, but we should be treating diet-related diseases like a crisis, because it is a crisis. What we put in our mouths and how our bodies are affected by that is definitely a crisis. And so the other point that you brought up was about either you or Katherine said it, in terms of who controls what we eat, right? And here's where I'm gonna get a little controversial, is that, you know, it was reported by Feeding America, and Feeding America is a network of about 200 food banks. They said that between April and December of last year, that their network distributed almost 7 billion pounds of food. And so when we talk about who also controls what we eat, particularly who controls what those who are most vulnerable eat, I don't think we do enough of a good job of digging deep into food banks and the type of power that food banks in this country have. And so, Katherine, you know I'm a localist and I do believe in community, but I by no means want to abdicate the responsibility of our government ensuring that the most vulnerable are also fed. Because at one period and point in time in this country, the government was in the business of feeding people. And it was in the 80s when the government became too big, or as Ronald Reagan put it, and began to cut food programs, that this feeding individuals who are most vulnerable and creating a safety net for those individuals became not a government policy, but a charitable model. And then we see the explosion of food banks. And might I add, food banks, some of them across the country, not that they don't do great work, but they have multi-million-dollar budgets. So the question also becomes who has the power and who has the control of what our most vulnerable people get access to. And in many cases, ladies, it's processed food that are being distributed at some of these food banks.
Yeah, no, go ahead.
I would encourage anyone on here, if you have never been to a food bank warehouse, they are enormous. They are many football fields long. They are huge. The scale of our charitable food system is actually unfathomable unless you see it. It is huge, huge, huge. And it is mostly shelf stable processed food, although there are a lot of food banks that have, worked really hard to get more produce and more fresh. It's really hard to do. But people forget, and I think I'm sure Davina and Katherine, you know this, but a lot of people forget that, everyone likes it. There's a lot of bipartisan support for food banks. It's this very non-controversial thing for charity, to be this safety net for folks. But SNAP, the food stamp program, a lot of people still call it that, feeds like 10 times the amount of meals, even though that system is massive in scale. So the scale of feeding the country and those in need is just enormous. And I think that we often forget that. And one of the things about the pandemic that I think was so striking for people is seeing those lines, the cars lined up in the food bank. And, we had all those aerial shots of, of people lining up. And I think one of the things that we didn't acknowledge is that happens every day in America. They just weren't lined up in their cars. So we didn't really fully see the visual scale of need in a way that we were really able to see it during COVID. And I think that visual image really clicked for the country to see the scale of just how many people were one paycheck away from real financial stress, like not being able to pay their bills, not being able to feed their families. So there's real acknowledgement, I think, of just how many people in this country are in that position every day, and were before COVID.
No, and I'm such a bad moderator because I just realized we only have a minute or two left.
Oh, no.
I just cut anybody off. I'm like, whoa.
Return next week for a 3-hour conversation.
Well, that's what I was going to say. I mean, this is so hard to get into 1 hour, right? Because it is systemic. I mean, you guys have touched on so much, the health and safety and the necessary championing of our food workers. This consolidation piece is so important to look at. And I actually think it has also some implications into the industrial feeding complex, right? Like the consolidation pieces, how we deal with, some of the policy emergence. I mean, we could do this for hours. I do want to be sensitive to both the audience and you guys and just kind of skip ahead to, I always like to do like a little bit of a wrap question of like, what is the one thing that you want people on this audience to look at or take a look at or read or just get more aware of as they move forward, or watch? Is there something you want them to watch the Biden administration do? I really want to watch the USDA I really want to watch what USDA does related to meat processing and diet related diseases, but that's me. Davina, what do you want them to do?
Oh, I mean, Katherine, Helena, we've had amazing conversation, but I tell you what, as much as I am an advocate, an activist, and totally committed to the food system, the hill that I am going to die on is voting rights. If we as a country do not wake up to the fact that not only was the pandemic an opportunity to use as a way to further increase wealth inequality in this country, but now they're following that up with just these voting restriction laws all over the country. So they're trying to, and I don't want to be hyperbolic, but they're trying to take away our democracy and our ability for everyone to have access to the ballot box. We're not paying attention. And so the thing that I cannot stress for people to do is to get engaged. All politics are local, and please make sure that you're doing whatever you can to make sure that all individuals who have the ability and the right to vote can vote. And so access to the ballot for me is number one.
Yeah, well, I just want to say before we wrap up that, Davida, I've followed your work for so long, and it's really an honor to be here with you, although I hope to get to Detroit soon to learn a lot more about what you're doing there. It sounds incredible. And Katherine, thank you for organizing this. I'll go back to diet-related disease, because I really think, and I'm probably going to have, I'm going to write about this in the next couple of weeks. I think there is just a huge hole in terms of what conversation we're having about getting the country to be healthier. And that means everyone. And there's just no question that those social determinants of health and disparities in not just health access, but food access and, at schools and neighborhoods and grocery stores, there's just no question that drove a lot of the inequities we saw in death and illness. There's no question about that. The data are very, very clear. And there's no question that our country was much more vulnerable to COVID-19, much more vulnerable because of our diet-related disease epidemics. And Davida, you are right that it is a crisis. It is. I don't have an opinion about that. Like, the numbers show us that it is a crisis. We can't afford the healthcare costs. So even if you don't care about the actual health side of it, just financially, the country can't afford it. So I would keep an ear out for where that conversation is and isn't happening post-COVID. Are we taking another look at school meals? Are we taking another look at SNAP and how we support people in the emergency food system? You brought a good point. I don't know. Is that something that is being thought about with more urgency? I think that's a really big issue to watch going forward.
No, I think that I 100% agree. I want to thank both of you. We literally could do this for a couple more hours, and hopefully we'll get a chance maybe to do it again. But I want to thank you both so much for being here. I put it into the responses to all the panelists and stuff, a couple of links to the Twitter feeds for both Helena and Davida, so that you could follow them. You should subscribe to the Morning Ag Pulse newsletter on Politico as well. There's a free version if you don't want the expensive version.
The free version is still really great. Recommend it. Yeah,
it's so great. I highly recommend it. There is also, I just want to thank the Sine community for coming out today. We didn't get to a couple of the questions, but I tried to answer them with some additional resources, but we'll hopefully the Sine folks will follow up with folks. And then just thank you all for caring about our food system. I mean, I think if the diet-related diseases show us as an example of it's everything that you want to talk about: consolidation, workers, health, safety, the environment, and also the ability, if we change our diets, we can change our outcomes, and both in our communities and our bodies and our planet. So I just want to thank you both, and thank everybody for joining us today. And this will be it's on Facebook. It'll be live up. We'll send the link around, and hope to see you again soon. Thank you both.
Thank you.
Thanks, ladies.